Hello, the webinar has started, the screen tells me. So, first question. I have a very short luteal phase. How can I lengthen this part of my cycle? So you guys know what a luteal phase is? The luteal phase is the time from ovulation until your period comes. It's like that part of your cycle where you get pregnant. Now, normally it's about 11 to 14 days. It doesn't usually go over 15 days. And if it's like less than 10 days, that's considered, like this gal's asking, a short luteal phase. That's really important because, once you ovulate, right, the countdown starts. Once you ovulate, it takes the embryo about 5 to 6 days to grow before it implants in the uterus. It's just kind of tootling down the tube there. It will maybe take about a day to hatch, and then it will implant. So it takes a bunch of time. So we need at least 10 days. So if you don't have that, you have what's called a luteal phase defect or a short luteal phase, and that's a problem you want to get fixed. Now, it's an easy remedy. Usually it means you're short on progesterone. So you go to your doctor and you can have him prescribe you progesterone, and that'll just lengthen right up, problem solved. Doesn't impact eggs, doesn't have anything to do with anything. Why do you have it? Who knows? But we do want it fixed if you do. So that's one way to lengthen it. Also, there is a supplement called Vitex, Vitex. It's the supplement chasteberry. And they promote that as being something that, like I said, an herbal supplement that can elevate progesterone and extend your cycle. Some people swear it works great. Others say, I took it and I didn't like it. You never know with these things, but it's something you can at least do on your own. Good question. Okay, next one. Just want some general planning advice. How long to wait and what questions to ask your doctor, if you've been trying a while and it's not working. So, all right, how long do you wait? Well, the short answer is you can wait as long as you want to. You don't have to do anything. And sometimes if an insurance company says you have to have been trying for 6 months, so go in there and say, I've been trying for 6 months. I don't care. Nobody knows. There's no cameras in your house. Well, at least that they put up. So, so there's sometimes there's like some insurance parameters, but how long you wait? I mean, I personally probably would wait about 3 months before I'd be going crazy and I'd have to go see a doctor, ask questions. Technically, they'll say that if you're under 35, try for a year. If you're over 35, try for 6 months. Now, first we have to define what's trying. I mean, I've had gals say, I've been trying for a year and nothing. And then I'll look at their charts and I'll see they might miss a lot of LH days, or they're not having sex on the right days or enough sex. And then it's like, well, half of these months I wouldn't even qualify as trying. Like there was a minimal shot you'd get pregnant. So we get, make sure you're really trying. The reason when you're over 35, we say 6 months is simply because you just don't have much time. We don't have time to fool around anymore and wait and see. When you go in to see your doctor, I do want you to be educated. And I'll tell people, if you want to set up a virtual consult before your doctor, because I'd love to educate you so you can go in, understand what they're saying, and know what to ask. Now, you're going to have your chart. You'll have them right there on your phone. So you can certainly show your doc what things have been like for you so they know. But basically, two elements of this appointment. One is going to be, how come I haven't gotten pregnant yet? Is it just bad luck so far or something wrong? And that leads to the testing portion. So there's and of course, your first lines of testing should be a semen analysis, which it's best if those are done in a laboratory, and any doc can write a prescription for those. Laboratory is going to give you a lot more detailed info. They do have at-home semen analysis tests you can get online. It's better than nothing, but I prefer a laboratory test. HSG, the dye test. Let's make sure those tubes are open. Those are your top two. Why can't I get pregnant at home? Because if the semen's really bad or the tubes are blocked, you're not going to get pregnant at home, at least not very easily. There are other tests, other blood tests to get done, hormone tests for you, things like that. But by and large, those aren't per se preventing you. Now, some of you may say, well, I've got really irregular cycles. I don't know, my PCOS. Certainly going into it, when you know something's wrong, then go into it. If you're not ovulating, go into a doctor right away. You don't have to wait. Don't wait 6 months to say I haven't ovulated for 6 months. If you're I was the kind of PCOS gal who didn't ovulate ever. So what am I going to wait a year for or something? I'm going to go in and tell them because they can. And that's the second part of going to a doctor. First part is testing. Second part is treatment. Do you want to do anything? They could just maybe prescribe you some oral fertility medication like Clomid or Letrozole. For girls who ovulate normally, is that necessary? Maybe not. No, you're ovulating, but it may make you ovulate a couple of eggs, so it could increase your odds. And again, that's just taking these pills and having sex at home. You may up the ante a little bit and take the Clomid or Letrozole, and I prefer Letrozole. Clomid has some side effects. And you will maybe do inseminations, IUIs. This will increase your chances just because they can time everything perfect. And they can inject that sperm right into the uterine cavity through the cervix, and that will really give the sperm a leg up, if you will. So that'll help things along. But those are the two reasons you're going to get testing done, and then to ask, do I want treatment? Do I need treatment? Okay, let's see. I'm going to take a peek. We got a couple of live questions coming in, so I'm going to do those. Okay. What are the indications that your tubes are closed if you haven't been tested? That's a really good question. None. I mean, you won't know. Girls who have blocked tubes don't know they have blocked tubes. However, I always ask a very key question that is usually the result is blocked tubes, and that's this. Have you had pelvic inflammatory disease? What does that mean? Have you had chlamydia? Like every other person's had chlamydia out there. And a lot of people don't even know they've ever had it or did have it because it's like there's no symptoms to it. And maybe you take an antibiotic because you had your wisdom teeth out, and lo and behold, that took care of your chlamydia and you never even knew you had it. Chlamydia can cause, it's an infection, but it can cause scarring. And specifically, these little tubes, they're like little tiny skinny things. And inside of them are little hairs that move the egg along. So if you get scar tissue in those tubes, boom, they're blocked, So you wouldn't really know it. But if you knew you've had pelvic inflammatory disease or chlamydia in the past, then that's a reason to run to go get it done. Again, don't wait 6 months because, again, let's just rule it out. Let's make sure that's not a problem. Or you've been doing all of this for nothing if they're both blocked. Good question, though. All right, I had another question about prolactin. Prolactin level of 30, 5 years after I stopped nursing my first child, other hormones, FSH, et cetera, are all good. Doc sent you for an MRI, sending you to have one done. My cycles are normal and I ovulate every month, trying to conceive for 7 months, and I'm 35. Can this prolactin level be a reason I'm not conceiving? So thanks for asking. That's another really good question. So prolactin is the breastfeeding hormone, but it can't. So just like a gal who's breastfeeding, she has a higher prolactin level. And that's why generally those gals are not ovulating and they're not having periods. Your body doesn't, your body knows you're focusing on breastfeeding. So it doesn't want you to get pregnant right now. So it holds off on the ovulating. Now, as you lessen the amount that you nurse, your prolactin level will start to go down and those gals will start to get periods back and they're starting to ovulate again. Now, this particular gal who asked this question, she has a prolactin level 30. It's like borderline. Usually we like it under 25, but here's the key thing. Is your prolactin causing a problem? Now, I would like to get it. And again, oral medication, Docinix, Cabergoline, there's just oral medications you can take, boom, drop it right away, problem solved. Your doc is sending you for an MRI because prolactin comes out of little pituitary tumors right underneath our brain. So they just want to make sure there's not a little growth, not cancer or anything, but just sometimes there can be a little growth there, benign growth that will cause an elevated prolactin. So they do an MRI to see if that's there. Very, very rarely is there anything there, but it's a good doc who's looking to make sure that's not a problem. But again, if you're ovulating normally, that's the biggest problem is an elevated prolactin prevents you from ovulating, but you are ovulating. So that's a long answer to say, no, I don't think that's the problem with conceiving. I don't think that would be it. Though I would like to see that below 25. I mean, we don't need to complicate things. You're 35, so it's going to take a minute. You've had a child. We know your body works and all of that. But, it's not easy anymore. It could take up to a year. But again, I want to focus on you need to be really trying. I want to see LH tests done every day. I want to see sex in that fertile window. So I want to really see that we're really trying and throw in BBT to confirm we're ovulating. That's an example of really trying. And I think I have a good question over here about, okay, somewhere in here. But it's a good question that asks, when is the best time to have sex? What exactly do we mean by fertile window? So since I just brought that up. So, all right, you're doing your LH test, right? And you get a peak. That means it measured you got your LH surge and you're going to ovulate the next day. So the two most important days to have sex is the day you get a peak and the day after the day of ovulation. If you're like, you're only going to have sex twice, those are the 2 days. Now, I'd be happier if you'd have more sex though. The fertile window is considered the 5 days leading up to ovulation. And the reason we pick 5 days is because sperm can live in your body for up to 5 days. So in that 5 days prior to ovulation, I'm of the club that believes the more the better. Now, that's not always possible. You got a life, you got kids, your partner can only do what your partner can do. So you do your best, but I'd say, have sex every day in that fertile window, if possible. But those 2 days are key. Those are what are most important. All right, let's take a look at our live questions. What should your progesterone level be on day 21? That's a good question. And that means that somebody is getting their progesterone about a week after you. If you're nervous that for some reason your progesterone is low, why would you be nervous of that? Why would you even think that? Well, if you have spotting sometimes in that luteal phase, the time between ovulation and period, if you have a short luteal phase cycle, then we can be suspecting there could be a progesterone issue. Generally, if the progesterone's over 5, if you didn't ovulate, it'll be like less than 1. It'll be really low because you didn't ovulate and you don't have, if you don't ovulate, you don't put out any progesterone. So it'll be almost next to nothing. But yeah, if you're getting it tested, anything over 5, and once you're pregnant, usually it's over 10 kind of thing. But it's not like your HCG when you're pregnant that keeps going up. It just it goes up a little bit throughout your pregnancy, but yeah, anyway, that's your progesterone level. Good question. And somebody had a good question in here. Let me find it. And it was about, we did best times to have sex. Yeah, this was a good one. Speaking of progesterone, she said, I get nauseous from progesterone in my body during my luteal phase. Is this a bad sign for morning sickness when I get pregnant? Kinda, but not really. However, I am going to feel sorry for you when you get pregnant. If you're sensitive to progesterone at lower levels after you ovulate, yeah, you're going to have a real good time when you're pregnant because that's the pregnancy hormone, progesterone, and you're going to have more of it around. So you happen to get nauseous from progesterone. There's usually a whole host of side effects to progesterone, sore boobs being one, moodiness, bloating, constipation. Now, the morning sickness when you're pregnant, that has more to do with the HCG levels, not progesterone. So that's why most women who get true morning sickness from a pregnancy usually don't get it until they're about 6 weeks along, which is about 2 weeks past a late period, a missed period. So usually that's from HCG. If you get nauseous from progesterone, yeah, you're going to have a lot of fun when you're pregnant. But yeah, you'll probably have that. Some women get really sick while they're pregnant. They have to actually get fluids and be on medication. There is medication you can take to help with that if it's really bad. All right, let's take a look at our, all right, well, we're on progesterone. Should I test my progesterone during the 2-week wait? I mean, no, it's not necessarily a standard thing I'd recommend across the board to anybody. So for example, if your luteal phase is, closer to 11 to 14 days and you don't experience spotting during that time, I have no reason for you to go get a progesterone level. You're not showing any symptoms for it. So I wouldn't run to the doctor. But if you're at that place in your conceiving life where it's time to go to the doctor and get testing done, that's probably something that they'll check out. But yeah, usually it's done about a week after you ovulate. So 7 DPO. Okay, here's a question. PCOS, my sister. I have PCOS. For the last 3 months with a semi-gluten and sugar-free diet, I've had a 38-day cycle. I ovulate around cycle day 22. My ovulation chart for this month has been wonky with the highest point at 0.7 instead of the 1.7 or higher previously. Is there any tip you can give me for this scenario? I'm praying to conceive. Oh, I hear you, girl. PCOS is a biatch. Oh, had it all my life. So my PCOS was very weight dependent. I can tell you that. Sounds like yours is almost, from what you're saying, dependent on how you're eating and that. Now, I don't much mind what the peak levels are. I mean, you can have a peak level at, 0.7, 0.8, or some people will get all the way up to 4 or something. So I don't, whatever it says is your peak, good enough for me. You don't ovulate any harder because it's higher. So I don't care as long as I know you really do ovulate. Now, it sounds like you are ovulating because, again, the biggest test did I ovulate is, did you have a period? I mean, that's all after the fact, of course. But having a period pretty much tells me you did ovulate. Not breakthrough bleeding, not spotting, but you have, like this gal saying, she thinks she ovulates around cycle day 22. So it's about 16 days later, she gets a period. That's fine. But again, if you're getting a period regularly, like in that 11 to 15 day time period after ovulation, then yeah, that tells me that you did ovulate. So yeah, I don't mind the numbers at all. As long as you're ovulating. I mean, if you had a 38-day cycle, that's beautiful. I'd have killed for that. So hopefully it works out for you, my love. All right. Here's a question. Oh, so sad. Somebody had a DNC, at 19 weeks. How long does it take for your body and cycle to get back to normal? So, I'm so sorry. That's a terrible scenario for you. It's not the DNC, of course, that's causing it to take a while. It's the fact that you were pregnant, right? So you got pregnant and you got all the way out to 19 weeks and then had to have a DNC. So you were pregnant. And the question is how long does it take for my body to snap back? Well, this varies, but it can. Anytime I'm going to say mess with your hormones, meaning, did you get pregnant? Did you have a chemical pregnancy? Did you take birth control? Were you on depot? These are all things that you have, reconfigured temporarily your hormones for good reasons or bad reasons, whatever, doesn't matter why, but your hormones have been reconfigured. So it's definitely going to take a minute for your brain to talk to your ovaries again in some normal fashion. Now, some gals, it might just be a month. Others, it can be up to a year, like being on the depot, that could take a while to snap back. Now, in your case, since, you had a DNC and that's at 19 weeks, now I'm thinking not about the hormones. You may ovulate fairly soon. You could be somebody who bounces back in a couple of months, but I would certainly follow your physician's advice on when is it safe for me to get. You may ovulate and be able to get pregnant, but that doesn't mean your physician recommends it because of the procedure you had. So make sure you check with your physician about what is a good time frame to get pregnant after your DNC. Okay, another good question here. Thinking of trying IUI. Does it matter what type of sperm wash the doctor uses for IUI success? Well, I know sperm banks do have different ways of washing and prepping the sperm for you. So you do want to make sure if you're having an IUI, you want to make sure you get an IUI prepped sperm. If you were doing IVF and ordered sperm, it really doesn't matter. I always tell my patients, order the cheapest one. But there are people sometimes just do intracervical or intravaginal inseminations, and that's a different wash than an intrauterine insemination. So make sure you do get an IUI prepped sperm. Okay. Last question live before I head back over to the pre-questions we had. I had a blighted ovum in my early 20s before. Okay, blighted ovum basically means there was like never any, you did get pregnant, but they call it a blighted ovum because there's literally, it's just a big empty sac. There's nothing there. There's not a baby there. There's just a fluid-filled sac. But this is the only time I'd gotten pregnant. Is that a bad sign? Does it show I can get pregnant? I'm now 40 going on 41. So, well, it showed you can get pregnant in your early 20s. It showed obviously your tubes were open back then, but that was a long time ago. So why are you not again, there's not and listen, I got pregnant and had a baby at 45 naturally. It can happen. It's like, that's a shot in the dark though. Like 1 in 100 chance of that happening, but it's going to happen to somebody, and it happened to me. That must have been, the universe giving me a gift back after, it gave me PCOS through all my reproductive years. But you're going to be 41. So what are the chances of getting pregnant naturally at 41? They're going to be less than 10%. So, we don't have to look hard for a reason as to why is it not happening. But it doesn't mean women are getting pregnant every day at 40 and 41, every day. As we sit here, it's happening. So why not you? So, but wait, what that means is we have to be on our game, and we have to be on our game quickly. So I want you to make sure the tubes are open. I want you to make sure the sperm is good sperm, and then I want you to be doing those LH tests, and I want you to be having sex as much as you can in your fertile window. You've got to give it your all. I was newly married when I got pregnant I got pregnant at 44. I had the baby at 45. I used to tell my coworkers that, again, I was in my honeymoon time period here, and it was like, I have live sperm in me 24/7. We were having sex all the time. There wasn't a time I didn't have live sperm in me. So I don't know when I ovulate because I have PCOS, but there you go. That's how it happened. That is how it happened. So the more sex, the better. But no, I can't say the thing in the getting a blighted ovum in your 20s does anything for me right now, though. But you can get pregnant. You just got to work at it. You got to be quick here. We don't have time to dilly dally. All right. I'm just reading. We got some later questions that were thrown in here as well for us. About abortion, how long did it take to get pregnant? It was my first try and I'm feeling discouraged. That's rough. Most of the gals that I've come across on the app are perfectly fertile gals, and a lot of them have gotten pregnant previously. And maybe they were at times they didn't want to get pregnant, so there's no judgment over here at all. So regardless of the reason you had a D&C, doesn't matter, but you had a D&C. That's all. You got pregnant, you had a D&C. Theoretically, your hormones should bounce back within a couple of months, and you should start to ovulate again. So you can try to get pregnant as soon as you're ovulating again, basically. That was, well, you guys are hitting on all these things that happened to me. I got pregnant at 35 as well. I have 3 kids, and this is what PCOS did to me. All of my kids are 10 years apart. Who does that? Nobody. But that's just what PCOS delivered to me. So when I got pregnant at 35, I miscarried at about 11 weeks. Devastating. And I had a D&C. It was like my miracle pregnancy. And I had a D&C. And I went back to the IVF clinics. I was going to go back and do IVFs again because I thought I was, just going to be a one-child person. I was going to be happy with that. But when I got pregnant the second time, I got bit by that bug, went back to the IVF clinic. Before I could even start an IVF, I'd gotten pregnant the month after the D&C. And Echo is my 24-year-old right now. Okay. So yeah, start if you're ovulating, you can start, honey. All right. Is it safe to conceive with a TSH of 3? And I've got a question about conceiving while you're on levothyroxine. Okay, so I don't think I had any TSH questions over here, but so let's talk about that. TSH of 3 is normal TSH, but you've probably heard, or if you haven't, you're hearing now, that when you're trying to conceive, and TSH, by the way, is thyroid stimulating hormone. They prefer your TSH be under 2.5. Now, why is that? 3 is normal. Well, because and having an elevated TSH means you're hypothyroid, because TSH is a thyroid stimulating hormone. So when you're hypothyroid, your thyroid's trying to kick out more of this stimulating hormone to try to bring it up. When you get pregnant, your TSH naturally goes up as well. And that, not that this will prevent you from conceiving, but an elevated TSH can bring on miscarriages. So it's important to have a normalized, and again, we say 2.5 for a TSH. That way, when you get pregnant, it goes up, it won't be in a high state. So yeah, it's perfectly fine to be on levothyroxine while you're trying to conceive. As a matter of fact, a lot of women are actually put on that, and they're on that while they're pregnant. It's perfectly safe. Prolactin again. All right. Is it ideal to try to lower my prolactin to 25 from 30? I know I have been very stressed while trying to conceive, so that can raise the level too. That is absolutely true. Honestly, you can raise prolactin levels just by having the shower hit your nipples. I mean, or having your nipples even stimulated any other way can raise your prolactin. So sometimes, because prolactin medication I mentioned earlier, it can be a little tough on your tummy sometimes. It's not something you want to necessarily have to be on. So I might tell a gal, listen, your prolactin was borderline. Do me a favor. Come back next week. Let's test it again. But do me a favor, before you come in the night before, no nipple stimulation at all. And sometimes it comes back perfectly normal. It was just average nipple stimulation. I mean, it doesn't hurt to be on, you're asking about vitamin E, and B6 can lower prolactin as well. So nothing wrong with being on that. Okay. Terry, is there anything that you want to add to anything? We don't want to leave you out. No? Okay. We just have to look at her cute little face. Okay. Let's get some more questions answered. Let me go over to my other questions. All right, here's a good one. Is 9 DPO too early to take a pregnancy test? Well, you can take a pregnancy test whenever you want, and you will. However, here's what I'm going to tell you what real life is. Real life is most women do not get big fat positives that early. I recommend to everybody to not test for pregnancy until you're 12 DPO. Now, yes, you do see gals at 9 and 10 DPO get real positives. If I line up 10 pregnant women, maybe 1 or 2 will get a positive that early. The other 8 will not. Now, let me ask you a question. A couple of gals are going to go post about their results. Who do you think is going to post? The 8 that got negatives, or the 2 that got positives? That's right. The 2 that got positives are going to post. And then another 2 are going to post. And then another 2 are going to post. But the other 8 are not posting about it. So you know what you're going to think as you read through the blogs and the community boards and all that? You're going to think everybody's getting positives at 9 and 10. But the reality is they're not. It's just a skewed reporting. I'm telling you, because I see them all the time, and I see them in my Ask an Expert questions. They're not getting positives, but you know what? They're getting positives later. Now, I know it's hard to be patient. I get that. Totally get it. Just know, you know what it feels like to see a negative. You know what that does to your head. You know that. Be ready for that negative. If you tell me, oh, I'm going to be fine, you're probably not telling me the truth, because most of you, like me, are going to freak out about that, and it's going to upset you. And that weighs a lot more than your lack of patience. So I really strongly recommend you wait until 12 DPO. Okay. How long does it take the average couple to conceive the first time, and how does this change with age? Oh, well, it gets harder with age, for sure. And of course, you know, I tell you guys all the time, our eggs are as old as we are. So as we age, our eggs are aging too. And though I know we talk a lot about abnormal eggs, they're perfectly normal right now. Even if you're 42, your eggs are perfectly normal sitting in your body. They're just another cell in your body. And as long as you're chromosomally normal, all of your eggs are chromosomally normal. Problem is, in order to make a baby, we have 46 chromosomes, and so does my partner. Well, I need him to cut his chromosomes in half down to 23. I'm going to do the same thing with my egg. I'm going to split it into two. And that way, my egg and his sperm get together and make a human being with 46 chromosomes. The problem is all the parts and pieces in my egg are whatever, 30, 35, 40 years old. So they don't do that job so well. So whereas 23 chromosomes should come over here and 23 should come over here, it's not how it works. 24 come over here and 22 come over here, or 25 come over here and 21 come over here. Either way, I end up with just two abnormal eggs, right? And that's what happens. And that's why we have miscarriages. And that's why it's hard to conceive, because our eggs are getting older, right? Men make sperm every 2 or 3 months. So like their sperm is all ready to go all the time. And that's why an old man, though it's not as easy when you're in your 40s and 50s, but otherwise they still are making brand new sperm. So how long does it take? I would say if you're under 35, it's probably going to take about, again, trying. Remember what I defined as trying. If you're trying, you're doing your LH test, you're having your sex, it takes 6 months. If you're over 35, it's going to take closer to a year. If you're over 40, you're going to be really lucky if it happens in a year. You might want to start looking into getting testing done faster, getting some interventions, IUIs, IVFs, that kind of thing. But yeah, it is harder as we get older, for sure. All right, what we got over here? Fertility best practices and how long does it take for a healthy, well, we did that. We just answered that one, didn't we? Implantation bleeding. Is that a thing? Well, I'm not sure if that's what somebody said. Implantation bleeding for how long? Yeah. So it's not bleeding. When you ovulate, you might spot a little bit. And when I say spot, it could be brown spotting or pink spotting, couldn't be reddish spotting, but it's just like spotting for that day. More women have that. I never had that, but a lot of women do. Implantation bleeding, it's not bleeding. If you were to have it, and probably, and I'm saying if I lined up 100 pregnant women, probably less than half will have it that are pregnant. So don't use that as a guide as to whether or not you're pregnant or not. But again, it would be like spotting. It would be like maybe brown or pink. And it would just be that day. So it wouldn't be bleeding. Kristen, I miss you too. What else? All right, let's go over here. How to read the easy at-home test results. Okay, well, the good thing is you don't have to read them because the app reads them for you. You just have to read what the app translates it to be, right? Now, you guys know this. I have to talk about this all the time in my Asking Experts. When you're first testing, and could be all the way up until ovulation, you're going to get lows. You're going to get one low after another. Please keep testing and don't think it's a waste of time, because this is how the app gets to know you. And this is how the app is going to get much better at predicting what's going on with your body. So do keep testing. So it's very normal to get those lows. Now, some gals may transition into some highs. Some may never get a high. And people with PCOS, we tend to have a lot of highs. Highs don't mean anything necessarily. You don't have an LH surge yet. What we're looking for is that peak. When you get the word peak, some gals will have highs leading up to peak. Some won't. Some will be what they call rapid risers, and you'll go low all the way up to peak and back down again. That's why when you're in that fertile window, I often recommend testing twice a day so you don't miss that. Because sometimes if you're only testing every 24 hours, you might miss it. But the app will read it for you. And then if you're new to the app, like you've just started testing this month, go ahead after you get peak and do the LH test for like another 5 to 7 days. I just want to make sure that truly was your peak. Remember, the app doesn't know if your magic number is 0.9. It is for some gals, and they'll get a peak. So it might go, oh, Terry got a 0.9 peak. And of course, I've told Terry, keep testing. So she does. And sure enough, 2 days later, she gets a 1.2. So it does erase, it erases the first peak, turns it into a high usually, and it'll give you a new peak. But now it knows. Now it knows it's not going to be fooled again next month when it sees 0.9 for Terry. It knows that's just a high because it knows Terry will tend to peak differently. Now, if you do BBT, basal body temperature, at the same time, that really helps. I know it's a pain in the butt. I know it. But let me tell you, so many questions I get that are, did I ovulate? I'm not sure if I ovulated. And sometimes I'm not even sure. BBT helps us out. BBT will tell us if you did ovulate or not. This is kind of a 3-part question. So let's see how to read the best times to have sex based on results. Well, we talked a little bit about that. Definitely on peak day and definitely day after. That's ovulation. If you can, if everybody's into it, I would love to see 5 days of sex prior to that. That's your fertile window. Again, if you can only do every other day because that's what works, then do it. No problem. I'm not a believer that everyday sex is a bad thing, though. And skincare ingredients, products to avoid while trying to conceive. Well, usually what you're buying over the counter, benzoyl peroxides, and that's fine. It's the prescription medications like Accutane that are big no-nos while trying to conceive. So if you're seeing a dermatologist for anything, make sure you're checking with them on what is, or let them know you're trying to conceive. What are we on time? We're good on time. Okay. What are some helpful implantation tips? Well, there really are no implantation tips because when you go to implant, you've ovulated that egg and it hangs out in the tube for a minute, and that's where all the sperm meet it. And that's where you actually fertilize the egg, is in the tube. And then for the next 5 days, it's growing. It doubles to 2 cells, 2 cells to 4 cells, 4 cells to 8 cells. Now, when it's over 100 cells, it's at this developmental stage called blastocyst, and that's when it implants in the uterus. But it's taking its time tootling down the tube, and it lands in the uterus. It'll pick a spot, and it'll start digging its way in and implanting. What can you do to help that? Nothing. That's totally out of your hands. What you do have control over is making sure that sperm get to that egg in that tube. But actually, like, what can I do to help it implant? There isn't anything. That's out of your hands. So you're kind of just sitting back and you're a witness for that is all. My periods are 2 full days and 2 extra days of spotting. Is that a red flag? Nope. Nope. Sometimes people, if you told me my period is 1 day of spotting, I'd be a little worried. Some people just have heavier periods. Some people have light periods. Some people have spotting involved with their periods. There's generally not a big concern about periods. So I'm not worried about how long they are or what have you. How do I know if I am for sure ovulating? See, that's a really popular question. Well, again, the first clue is if you had a period. Like, again, I'm PCOS. I did not ovulate. I did not have periods. When you ovulate, your body starts producing progesterone. That's what makes your temperature go up. That's what gives you all kind of lovely PMS symptoms, et cetera. And after about 2 weeks, when you don't get pregnant, your body goes, well, shut off the progesterone. There's no reason for that to be. And boom, progesterone is shut off. It's that act of progesterone dropping suddenly that will bring on a period. So if I figure it backwards, if you had a period, that tells me your progesterone dropped. If you had progesterone around, that tells me you ovulated. Sometimes I'll see gals with like test after test in the app, and they won't show a peak. And I'll look and I'll see, well, when did they have a period? And I'll find their period and I'll count back 11 to 14 days. And sure enough, they either stopped testing too soon, they missed a day, maybe they're one of those rapid risers and they just really need to be doing it twice a day. But usually I can, so periods are your first clue. Yeah, you're ovulating if you're having periods. Now, when are you ovulating? Oh, that's a good question. That's why you need to do the LH test. Again, to confirm, I would do basal body temperature. Sometimes the app even can't figure out your body. Sometimes you'll have, again, especially if you're PCOS, you'll have a kind of just a higher level of LH all the time. So it might read a peak. And then it'll read a peak 2 weeks later. Maybe you have a really 60-day cycle. And it doesn't know what's going on. And I'll get questions and I'll say to a guy, oh, yeah, it looks like you peaked. If she's not doing BBT, she'll like write me back in another week or two. She's like, I just had another peak. It turned the last one into a high. I don't know. Am I ovulating? It's like, oh, I wish you were doing BBT, because if you were doing BBT, I would have been able to tell at that first peak you didn't really ovulate yet. The app's trying to figure you out too. So again, BBT is a great way from confirming it. Getting progesterone tests done. There are progesterone urine tests out there. I have not had good luck. My clients, my users have not had good luck with that. So I really can't promote that right now. But getting a progesterone blood test would certainly tell you if you ovulated. Tara, is there anything you want to add in or say? Again, I hate leaving you out. I don't like not hearing from you. I'm unsettled. No? Okay. I just have to keep staring at you every few minutes. Okay. Let's see. We got any other? Let's go back to Q&A. See, we've got some live questions. All right. Let's talk about a semen analysis. Is a sperm with morphology of 6%, 59% motility, and a count of 20 million? So absolutely normal. We like to see morphology. That means how normal, how good looking is the sperm. Over 4%, that's 6%. I like to see motility over 40 to 50%. That means what percent are good swimmers? 59% is perfectly good. And a count of 20 million. I like to see 15 to 20 million at least per milliliter. So yeah, those are all perfectly normal. Guys can vary. I'll tell you, if your partner's like, oh, he had kids a couple of years ago. He had kids 10 years ago. He had, okay, that's great. And I know his sperm worked then, but remember what I said? Men make sperm every 2 to 3 months. So if they start misbehaving, and what do I mean by that? Smoking is the worst, because that's a constant toxic thing they're adding to their body. Smoking a lot of weed, a little bit of weed, I don't personally complain about, but a lot of weed I would complain about. If they're in a hot tub a lot, if they're just in general not good health, and they won't make good sperm either. So get your guys, go online and order some male fertility supplements. It's got good antioxidants in it. And now, will that stuff help us too? Sure it would. We take supplements and vitamins because we're trying to be healthy during our pregnancy. Again, I can't really touch my eggs, good or bad. I can't do anything with my eggs. They've been with me since life. There they are. But yeah, get your guys on and get them out of a hot tub, get them out of tighty whities if they're doing that. Okay, are there remedies for getting pregnant with twins? Oh, like you want to get pregnant with twins. About the only thing I can say about twins is, yeah, if you take fertility medication, you are likely to ovulate more than one egg. So if you want twins, that's not a guarantee, but it certainly is a way to, there really is no way in your real life to make it happen without any intervention. But I was in IVF for 20 years, and plenty of times back in the day, we transferred 2 embryos all the time. And people didn't get pregnant with twins as often as you might think. But anymore, they don't even like twin pregnancies because they're riskier, I think they're cute, but they're riskier pregnancies. All right, another good question about a lab result. My AMH, that's anti-Müllerian hormone, that's a blood test that looks at your ovarian reserve. 35 years old is 1.96. The fertility doctor told me is unexplained secondary infertility. All other labs normal. How long should I try naturally with an AMH, with this AMH? Well, an AMH of 1.96 is perfectly fine. I love an AMH of 1.96 for sure. Now, when an AMH starts dropping below 1, for sure. And by the way, it's going to drop in all of us, because an AMH represents how many eggs do I have left. It doesn't represent how easy I'll conceive. It really points to 2 things. One, how close is menopause? Now, you're only 35, your AMH is 1.96. So, okay, I'm okay with that. What's average menopause? 48, 50, something like that. So, you'll probably have menopause around then. Now, if you at 35 had an AMH of 0.7, I would tell you, okay, there's nothing wrong with your eggs right now. You can conceive, no problem at all. However, menopause is probably not going to be 48 to 50. It's probably going to be 43 to 45. So it's coming faster because your egg numbers are dwindling. The second thing a low AMH means is if you are going to venture off into the world of IVF and they give you those drugs to grow follicles, grow eggs, you're probably going to grow less eggs than somebody else at your age who has an normal AMH. That's what AMH means to us. Thyroid issues. We're going to talk a little bit about thyroid. Don't be sorry. We talk about anything you guys want to. I had a physical last week and my blood work in June. My TSH looks like it came back at 3.3. Would my doctor have mentioned if this was concerning? I didn't know it should be 2.5. Okay. So no, again, doctors, unless you're going to like a fertility doctor or a doctor who draws your blood work, knows you're trying to conceive, most of them aren't going to say anything because the TSH is within normal range. But again, it is a good idea if you happen to know that your TSH is above 2.5, then yeah, if I'm trying to conceive, just again, because of the higher miscarriage rate, I would get put on levothyroxine, Synthroid, it's a thyroid medication. Usually doesn't have any icky side effects. Would I recommend the modern fertility at-home test? I would love to know more about, I would love for you guys to give me input about what you have found with those. Listen, I'm all for it. I love the infertility at-home testing. I love the idea that we can do an at-home semen test since men are so darn shy about, giving a sample like they've never done it before. But they're not going to be as good. They're not going to be as good as a lab running it. That's for sure. But is it good enough? Okay. Maybe it lets you know there's a problem so that you go get the real test done. I mean, again, if I was of reproductive age, I'd probably be doing everything because I'm obsessive about everything. So yeah, I would say that's not going to be a bad thing to do at all. Insulin resistance and fertility, not PCOS. Does gastroparesis impact fertility? Gastroparesis, or having trouble funneling things through your tummy, that shouldn't impact fertility. I've never heard of it impacting fertility. Insulin resistance, of course, is tied a lot to PCOS. And again, there are metabolic issues that go along with PCOS, but do the metabolic issues themselves cause infertility? No, not necessarily, though those are things that are, I know I'm at risk for diabetes. I know I'm at risk for high blood pressure. I'm at risk for these things, fatty liver issues and all that, high cholesterol, lipid issues. PCOS is oh God, it's terrible. But it is what it is. I lived through it. I got pregnant 4 times in my life, had 3 children. You can too. So don't be afraid of PCOS. I will tell you that my PCOS was very weight dependent. Let me tell you a little story. I might have told you guys this before, but I went to an RE, I don't know, like a bajillion years. My daughter's 30 years ago, I went to an RE, and that RE was like, oh yeah, you're classic PCOS. I was probably over 200 pounds then. And he was like, here, you got a script pad out and everything. I was like, oh, here we go. Some medication to help get this going. And what did he write on it? Weight Watchers, and handed it to me. What? Are you kidding me? I'm aware I need to. This is it. This is what I came for. So I left him and went right to another fertility doctor. My husband happened to have IVF insurance, so those doctors were more than happy to do IVF on me. And I went through 2 complete IVFs, and they did not work. Now this was long. This was 27 years ago. Then I went to nursing school, lost weight. Now, mind you, when I got pregnant with my first daughter, I was probably close to normal weight. Didn't even know I had PCOS then. It was after I had her and I was nice and fluffy and periods never came back that I was really diagnosed with PCOS. And I lost weight when I was in nursing school. Periods started to come back. And remember, I mentioned earlier, those 2 times I got pregnant at 35. Well, I would say I've always been chubby, but I was probably closer to 150, 160. So my PCOS is very weight dependent. Then I got fat and got pregnant, got fat. And again, periods gone. And then when I got into my early 40s, I started to lose weight again. And lo and behold, periods started to come back again. So mine is, but you got to take this insulin resistant stuff pretty darn seriously. There is medication called metformin that helps with this kind of stuff. It is a blood sugar medication, but it helps with things like insulin resistance and that kind of thing. All right, what else? We got any questions over here? I think we answered these guys. I've been spotting. I'm answering some new questions. I've been spotting since 2 DPO. and currently light pinks. No, and currently. Okay. So, all right. So you've been, so 2 days post ovulation. No, it's not time to implant yet. Remember, you implant, embryo's got to make it to 5 or 6 days old. That's when it's old enough to hatch out and implant. So you won't implant before 6 days. You might implant out in the 6 to 10 day window, but not 2. So it's definitely not a spotting from that. If you're sure when you ovulate, I would say you could spot with ovulation, but if you're sure you're 2 days post ovulation, I don't know, but I'm not crazy about it. Remember, anytime you have spotting in that luteal phase, you might be having low progesterone issues. Now, if it's a one-off deal, anything that's a one-off deal, like what happened last month, but it never happened again, I don't care. But if it's something that happens with any regularity, then I do care. Light pink spotting after first period, after miscarriage, should I be worried? Will it affect trying to conceive this month? No, I mean, remember I mentioned earlier, you had a miscarriage, so that means you got pregnant. And pregnancy is going to play with your hormones. So your body's trying to figure out, they're a little out of sync. They're a little out of cycle. They're not, you ovulate really late. You have spotting. You got to give it a couple, 3 months to get back to normal. So could it impact you trying to conceive? If you're not, in the fact that you might not be ovulating just yet. But if you're ovulating, you're good to try to conceive. Gestational age versus last menstrual period due dates and late ovulation, creating confusion with low HCG. Yeah, that's a rough one, huh? I'll tell you what I do. I cheat. Let me show you. I've got this little cute pregnancy wheel. These are the things that we use in the doctor's offices to tell how pregnant somebody is. So I use this all the time when you guys ask me questions. It basically, it's tied to ovulation. That's what it's tied to. Let me give you an example. I had a gal come visit me over and ask an expert. And she had really like super long cycles, like, I don't know, 40, 50 day cycles. Now she ovulated, and she found out her period was due and and her period was late. So she did a pregnancy test and she was pregnant. She goes into the doctor's office a couple of weeks later. So she's like theoretically about 6 weeks pregnant, right? And they ask her the standard question that they always ask to try, because most women have no idea when they ovulate. However, they do know when their last period was. So they asked her when her last period was, and she told them. And they went, oh, okay. And again, probably got one of these out and went, all right, based on that, let's see, you're 8 weeks pregnant. So let's go do that ultrasound. They go and do the ultrasound. She comes back and, of course, writes to me because she's freaking out. Linda, the baby only measured 6 weeks. They said, I'm 8 weeks pregnant. Oh, no. And I was like, wait a minute. Was that 8 weeks was based on your period? That means nothing. Get my wheel out. She was exactly 6 weeks pregnant. This is part of what ask an expert. Come visit me, not because I can give you data and facts, but generally you guys are off somewhere a little skewed and I can help center you and make you feel better. Usually, and I know this because I'd be doing it. I'm worrying about stuff I shouldn't be worrying about. And I just need somebody who might know this much more than me to tell me. And you know what? If there's a reason to worry, you bet I'll tell you there's reason to worry. But most of the time there isn't. So yeah, pregnancies are dated back to your last period. If you know when you are, I had this problem. Like when with my first pregnancy, like, well, when was your last period? I'm like, I don't know, like 4 months ago. I know I'm not 5 months pregnant. And I'm like, you're going to have to do the ultrasound and tell me. And they did an ultrasound and they told me. And of course, how did we know that was accurate? Well, we just kept doing ultrasounds, every couple of weeks or what have you to watch the baby grow. And then they knew you're fine. This is how far along you are. And they gave me a due date, but it wasn't based on my last period. And I wasn't doing any of this LH testing. So I couldn't tell them when I ovulated. I don't know. So sometimes you don't know, but that's the difference between true gestational age and last menstrual period. Okay, what else we got? See if I got anything left over here. Let's see. Got another one. Is it normal to get a positive test on 8-DPO? Absolutely not. Is it okay? Sure it is, but it is not normal to get it. Meaning most women do not. What advice do you have for women with PCOS wanting to conceive? Do you have about another hour? Make that a day. So yeah. All right. It depends on how bad your PCOS is. Some gals have PCOS and they have regular cycle. Well, I should say they have cycles. Maybe they're every 38 to 45 days, but they have an opportunity to get pregnant. So if you have PCOS and your cycles are irregular, or you're like me and you just don't have cycles, your best bet is to see your doc about getting put on an oral medication to help you ovulate. Otherwise, you're not going to have a chance to ovulate, or you're going to have only 6 times a year compared to the normal gals who have 12 times a year. So you can get put on letrozole or Clomid to help you ovulate. And then you're like any other woman. It doesn't matter. It's just that we're not ovulating. So that's the problem. Again, for me, and I wouldn't want to suggest this to anybody because I know how I felt when somebody said it to me, I lost weight and it made a big difference. It's because we store a lot of male hormone in our fat tissue. So the fatter I was, the more male hormone I had, and that screwed up all my hormones and I just didn't ovulate. Yeah, PCOS. Now there's medication like metformin your doctor can prescribe for you. A lot of times that helps women ovulate without having to take Clomid or letrozole. You can do over-the-counter supplements like myo-inositol, it's called. I still take it. And it might help. It won't hurt anything. And again, remember, we have metabolic issues we have to worry about too, so it's good for that. Otherwise, yeah, PCOS. You have it for life. I think I did have late menopause because of it, though. And I think it was easier for me to get pregnant when I was old because of it, because I didn't ovulate in my 20s and 30s regularly. So I think it left a lot of eggs around. What general things were about? Okay, we got 1 minute left. What general things can you do to help your chance of conceiving at or over the age of 40? I mean, the problem over the age of 40 is just simply your eggs are older, right? So your eggs are older. There's nothing we can do about that. There's nothing I can do about making an egg normal when it's abnormal. You just be your healthiest you. That can only help. And do your LH tests. Do that. Do your BBT. Be vigilant about this. Somebody's going to you have normal eggs. You absolutely have normal eggs, and people are going to get pregnant. Why not you? You just got to be on your game. That's all. All right, Tara. Should we wrap up? Yeah. All right. Thank you guys so much for coming. I'm sorry Terry couldn't participate more. Darn internet. We love having you guys here. Terry and I love doing this. Normally she participates a lot more. Remember, if I didn't get to your question or you think of it later, come visit me and ask an expert. I've formed relationships over there with people. You get, and I don't know the details about it. If Terry could talk, she might know, but when you join the memberships, you get free question credits, and then you get questions at half price or discounted prices. Remember these memberships, you get a free box of ovulation sticks. That's like $20 right there. So when you're in silver, you're paying like for 3-month membership, I don't know, you're paying like $5 or $7. It's like they're giving it away. So think about doing that because you get a lot of access to the questions that I answer in Ask an Expert too. So you can try to see if somebody had similar questions to you. Thank you guys. Thank you for coming. I love you guys too. And Terry, we'll do this again next Thursday, I imagine, same time, same bat channel and all that.
Yeah.
Right? All right, guys. Thank you all for coming. I love seeing you. I love you guys. And I will see you over in Ask an Expert. If not, I'll see you next week. Tara, have a great night. Bye, guys.